everyone, thanks so much for joining me today. My name is Lydia and this is Time with Lydia, the pharmacist. Today I'm super excited to spend some time with you talking about a very interesting topic. This is a topic that a lot of people have requested that I speak about, and it is high blood pressure. I have titled our chat today, High Blood Pressure, All You Need to Know. And today's chat is going to take a different form. I have prepared some slides that I'm going to be sharing with you. So sit back, relax, and let's get into it. And do make sure you stay till the end because there's a lot to learn about this topic. This is a channel where we educate ourselves on common health problems. So if you're new to this channel, please don't hesitate to hit on that subscribe button and also on the notification bell so you don't miss any video that I upload. So as I said earlier on, the topic is high blood pressure, all you need to know. So we are going to be looking at some statistics or some facts from the World Health Organization. We will define what high blood pressure is. We'll look at some signs and symptoms, the diagnosis, the risk factors, ways of preventing it, treatment, and I'll touch a bit on some medications that are used for the treatment of high blood pressure. And we'll look at some complications of high blood pressure. Then we would come to a conclusion. So first of all, let's look at some key facts from the World Health Organization. Hypertension or elevated blood pressure is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. An estimated 1.28 billion adults aged 30 to 79 years worldwide have hypertension. 2/3 of this number live in low and middle income countries. And an estimated 46% of adults with hypertension are unaware that they have the condition. And this is pretty serious because most people are walking about then with high blood pressure, not even knowing that they have high blood pressure. Less than half of adults, that is 42%, with high blood pressure or hypertension are diagnosed and treated, meaning that over 50% of adults with high blood pressure have not yet been diagnosed, even though they've got it. And approximately 1 in 5 adults with hypertension have it under control. So the question is, what is happening to the 4 out of the 5? This is a question that we all need to work towards and try to answer. And it calls for awareness creation and education such as these to help people realize that they need to get their blood pressure checked. Hypertension is a major cause of premature death worldwide. And we'll come to that when we get to the complications, because some of the complications can develop even when you don't know that you have high blood pressure or you've not been diagnosed with high blood pressure. One of the global targets for the World Health Organization is to reduce the prevalence of hypertension by 33% between 2010 and 2030. So what is the prevalence in the UK? Around a third of adults in the UK have high blood pressure, although many will not realize it. The only way to find out if your blood pressure is high is to have your blood pressure checked. I would advise that you get your blood pressure checked as soon as you can, because as I said earlier on, blood pressure is something that you can develop with no symptoms, and before you start experiencing symptoms, the disease would have been far advanced and complications would have started developing. High blood pressure is known as a silent killer, and blood pressure is the force that is exerted by circulating blood against the walls of the body's arteries. The arteries are the major blood vessels that help in circulating blood in the body. So the force of the blood as it circulates on the walls of the arteries is what brings about the pressure. And sometimes this pressure can be really high. So when the pressure is high, that is when high blood pressure or hypertension develops. And this can occur from different reasons. Blood pressure is written as 2 numbers. And the first number that you would normally see is known as the systolic blood pressure. and the second number is known as the diastolic blood pressure. And as you can see on the slide, I've given an example of 120/80. It's normally written as a fraction, and the unit of measurement is millimeters mercury. Systolic blood pressure is the number that represents the blood pressure in the blood vessels when the heart contracts or beats. And the diastolic blood pressure is the number that represents the pressure in the vessels when the heart rests between beats. So this is the kind of reading that you would expect when you measure blood pressure. You can get a normal one, an elevated one, a high blood pressure stage 1 or stage 2, and then you can get a reading that is described as hypertensive crisis. You would have a systolic and a diastolic number. So for a normal reading, your blood pressure needs to show a top number or a systolic pressure that is between 90 and less than 120, and a bottom number or a diastolic pressure that is between 60 and less than 80. So you're looking for a blood pressure reading of less than 120/80 millimeters mercury. A normal reading will be any blood pressure below 120/80 millimeters mercury and above 90/60 millimeters mercury in an adult. For an elevated blood pressure, you're looking at a systolic reading of between 120 to 129 and a diastolic reading of below 80. For stage 1, you're looking at blood pressure reading between 130 to 139 systolic and a diastolic reading of 80 to 89 millimeters mercury. When your reading is elevated or is normal, all you need to do is maintain a healthy lifestyle. No medication is required. Once you maintain a healthy lifestyle, you are able to reduce your risk of getting high blood pressure. When your blood pressure is at stage 1, then you would be required to measure your blood pressure over a period of time, and the average would be taken. And you will be required also to maintain a healthy lifestyle. When your blood pressure is measured and it is at stage 2, that is 140 or higher systolic blood pressure and a 90 or higher diastolic blood pressure, then this will be done a second time, maybe on the same day, or you would be required to get it done the next day. And if it is still high, then you will be put on some medication, as well as maintain a healthy lifestyle. When your blood pressure falls under the hypertensive crisis, then you would be required to visit your doctor immediately, or you will be required to visit the accident and emergency department. So, as I said earlier on, diagnosis is done when a blood pressure is measured on a number of days and the average is taken. In the pharmacy, for instance, we will do it on the first day and ask you to come back on the second day if the systolic blood pressure reading on the first day is greater than 140 millimeters mercury, and or the diastolic blood pressure reading on day 1 is greater than 90 millimeters mercury. Sometimes you will be advised to monitor your blood pressure at home and the average would be taken. So you will do this over a number of days and the average of all the readings will be taken just to find out whether you have high blood pressure or not. Home blood pressure monitoring has been proven to be very helpful, especially in this COVID season where a lot of people are not getting the chance to visit the healthcare centers. And it gives a better measure of the true average, allowing treatment to be better tailored, because what happens is when people have to visit the hospital or they have to visit their doctor, some people become nervous and anxious and they get worried. And because of that, when blood pressure is taken under such circumstance, the reading can be really high and this value could be false. So doing it at home in the comfort of your own environment actually gives a true average of what your blood pressure is. And this allows treatment to be better tailored to your need. So what are the signs and symptoms of high blood pressure? High blood pressure is known as a silent killer. And this is because most people do not experience any symptoms at all. Normally, the symptoms will start showing up when you've had the condition for a long time, sometimes even years. And symptoms can include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, buzzing in the ears. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. If you've got any of these symptoms, make sure you make an appointment with your doctor. It could be that it's not high blood pressure, but just to be on the safer side, make an appointment and have a chat with your doctor or your healthcare practitioner. Better still, you can get yourself a home blood pressure monitor so you can get your blood pressure checked maybe once a month, just to make sure that you are healthy and well, and also maintain a healthy lifestyle to reduce your risk of developing high blood pressure. There are some factors that can put you at risk of developing high blood pressure, and we've got some modifiable risk factors as well as some non-modifiable risk factors. First of all, we are going to be looking at the modifiable risk factors. Unhealthy diets, that is foods that contain excessive salt, foods that contain saturated fats and trans fats, can put you at risk of developing high blood pressure. If you're someone who doesn't eat a lot of fruits and vegetables, you are at risk as well, because you get a lot of nutrients, that is your minerals and your vitamins, from eating these things. Physical inactivity is also a risk, and then consumption of tobacco, both active and passive smoking, can put you at risk. Alcohol can put you at risk as well. Overweight or obesity, and when you don't get enough sleep or have disturbed sleep, you are likely to develop high blood pressure. The non-modifiable risk factors include age, and if you are above 65, then you are at a higher risk. If you have a family history of high blood pressure, genetics, if you are of Black African or Black Caribbean descent, and if you have a coexisting disease such as diabetes or kidney disease. And this is because these conditions do affect your blood vessels, and that can affect the pressure when blood is circulating in your vessels. So prevention of high blood pressure. There's so many ways that high blood pressure can be prevented. You need to reduce your consumption of salt. Salt can raise your blood pressure. The more salt you eat, the higher your blood pressure. So eat less salt. If you're someone who loves eating food with a lot of salt, start by reducing it slowly till you get used to not even using salt in your food anymore. And it is recommended that the total amount of salt you take daily should be less than 6 grams, which is about 1 teaspoonful of salt a day. Eat more vegetables and fruits. Eat foods containing more potassium, as potassium can make your heart strong. And limit the intake of foods high in saturated fats. Avoid eating high quantities of biscuits and chocolates, and also processed foods, as they contain a lot of saturated fats, and eliminate or reduce trans fats in your diet. Some examples of food sources rich in potassium include banana, avocado, pear, green leafy vegetables, and kiwi. Another thing that you can do to prevent high blood pressure is to be physically active on a regular basis. You've got to keep moving. Regular exercise helps keep blood pressure within the normal range as you age. It also helps you lose weight and maintain a healthy weight. And it is required that you be patient and stay active, because it can take 1 to 3 months for exercise to influence your blood pressure, but definitely it does have an effect on blood pressure. And avoid the use of tobacco. If you're somebody who smokes, then start thinking of giving up smoking. And if you don't smoke, then make sure you don't get close to people who smoke, because passive smoking can also cause an increase in blood pressure. Also, monitor your weight and waist circumference. Being overweight increases your risk of developing high blood pressure. If you're overweight, losing as little as 5 pounds can help lower your reading. And in addition to the number on the scale, waist circumference also plays a role in your risk level. In men, you want your waist circumference to be lower than 40 inches. And in women, you want your waist circumference to be lower than 35 inches. Because anything greater than that can put you at a greater risk of high blood pressure. Now let's look at the treatment of high blood pressure. Treatment and management of high blood pressure can be done using drugs. And also, there are some non-medicinal ways of managing high blood pressure. A drug is selected based on a lot of factors. So once you're diagnosed with high blood pressure, your age will be taken into consideration before a drug is selected. Your race, whether you are pregnant or planning to get pregnant, and whether you have conditions like diabetes or a kidney problem. All these factors will be taken into consideration before a drug will be selected for you to take. There are various drugs that are used, and I'm going to touch briefly on the different groups of drugs that are used for the management of high blood pressure. So first of all, beta blockers. They help in reducing the heart rate and in doing so, reduce the blood pressure. And examples are atenolol and bisoprolol. Common side effects of beta blockers include dizziness, headaches, tiredness, and cold feet and hands. We've also got the diuretics. These are known as the water tablets. They increase the number of times you urinate, and in turn, they reduce the sodium and fluid content, resulting in a decreased blood pressure. So what happens is as the fluid and sodium content is reduced, the amount of blood becomes less, and hence the pressure on your arteries is decreased. And examples are bumetanide, indapamide, and bendroflumetazide. And side effects include frequent urination, increased thirst, and dizziness. One point to note with these drugs is that it is best to take them in the morning. The reason being that because it causes a lot of urination, you are awake and it becomes easier than taking them just before you go to bed, which might cause a disturbed sleep because then you would have to wake up a lot of time to visit the toilet. And then we've got the angiotensin converting enzyme inhibitors. These widen the blood vessels and aid easy blood flow. Examples are lisinopril, ramipril, and enalapril. One common side effect of these drugs is persistent cough. And when this happens and it becomes so uncomfortable, then I would recommend that you visit your doctor and let them know so they can change over your medication to something that would cause no cough at all. There's a group of drugs called angiotensin 2 receptor blockers, and they also help relax the blood vessels to lower the pressure. And most of the time, when you're coughing with the lisinopril or the ramipril or enalapril, and you're not comfortable with that, you're changed over to this group of drug, which is the losartan, candesartan, irbesartan, valsartan, or olmesartan. The side effects of these drugs include headache, cold, and flu-like symptoms. And then we've got the calcium channel blockers. The calcium channel blockers are commonly used. And examples are amlodipine, felodipine, lecanidipine, diltiazem, and verapamil. They reduce the amount of calcium entering the heart muscles, and in doing so, they reduce the heart rate and control the blood pressure. Common side effects of the calcium channel blockers include headache and swollen ankles. And if you experience any of these side effects, make sure you let your doctor know about it. And then we've got the alpha blockers. These are not commonly used, and they are used as an add-on to most of the drugs that I have mentioned already. They do relax the muscles of the arteries and vein and reduce the blood pressure in doing so. Examples are doxycycline, prazosin, and terazosin. So now complications of high blood pressure. Complications will develop if high blood pressure is not diagnosed on time. And as I said earlier on, high blood pressure is known as a silent killer. Damage is done silently, sometimes years before diagnosis is made. And complications can affect your quality of life. It can lead to stroke or heart attack and even sudden death. So it is advisable that you get your blood pressure checked at least once a year, so you know that you are not hypertensive, and also maintain a healthy lifestyle to reduce your risk of developing hypertension. High blood pressure can damage your heart, and examples of some of the conditions that you can develop is angina. You can develop arrhythmia, which is an irregular heartbeat. You can get heart attack and sudden cardiac death. High blood pressure is one of the most common causes of kidney failure. When kidney failure occurs, then you would have to undergo dialysis. It can cause damage to your eyes, and this can lead to bleeding in the eyes, blurred vision, and loss of vision. And all these would occur because of damage that is done to blood vessels that supply blood to these organs in the body. High blood pressure can also cause damage to the brain, and this can lead to a mini stroke, a stroke, or vascular dementia. A mini stroke is caused, or it occurs when there is a temporary cut in the blood supply to the brain, and a stroke actually would occur when blood supply is cut off, or a part of the vessel is damaged such that the flow of blood is interrupted to the brain. And then it can cause vascular dementia, where the blood supply to the brain is also interrupted. It can also cause sexual dysfunction in both men and women. In men, it will lead to erectile dysfunction, and this occurs as a result of a damage to the blood vessels that supply the penis with blood. And high blood pressure can also cause damage to the arteries. And this is because of the constant pressure on the major arteries. As we mentioned earlier on, high blood pressure is the force exerted against the arteries as blood flows through the body. So as this force and pressure is constant and persistent, the arteries can be damaged. Yeah, and this can lead to serious issues for the person who has got this complication. In conclusion, I just want to say that blood pressure in the normal range is crucial in preventing complications such as heart disease and stroke. A combination of healthy habits and medication can help lower your blood pressure. A single high blood pressure reading does not necessarily mean you are hypertensive. Get a check done at least once a year because symptoms can take a long time to start showing. Maintain a healthy lifestyle. Look out for my video next week on non-medicinal ways of managing high blood pressure. And also, I'll be releasing a video on steps that you need to take to measure your blood pressure at home. Thank you very much for your time today. I hope you have learned something new. Please remember to share this with family and friends. And leave your comments and your questions in the comment section, and I would attend to them as soon as I can. If you haven't yet subscribed to this channel, please don't hesitate to hit on that subscribe button and also on the notification bell so you don't miss any video that I upload. Thank you for staying with me till this time. I really do appreciate your presence. I hope to see you soon in my next video. Bye for now.